Clubfoot is a common deformity that twists the foot inwards and downwards. It affects children from birth all around the world and often to both feet. Boys are more commonly affected than girls. This deformity can be corrected in 4 to 8 weeks using the Ponseti method, which involves 2 main phases: correction and maintenance.
El método Ponseti.
The Ponseti method, if done properly, is extremely successful. We can guarantee its success rate for children with clubfoot in almost 100% of cases.
Idiopático prácticamente en un 100% de los casos.
Before each treatment session, the foot is assessed using the Pirani scoring system to measure the severity of the clubfoot. Correction is the first stage of the Ponseti method, which includes manipulation, casting, and tenotomy. The foot is gently manipulated for 1 minute to stretch the tight ligaments and work out the best position for the foot in the cast.
Immediately the child is born, we find that the tissues, ligament, tendons of a child, they are very flexible, so it is easy to manipulate and stretch.
A cast is then applied by 2 trained clinicians to maintain the stretched position of the foot. These are full leg casts from toe to groin, with the knee bent at a 90-degree angle. When the parents take the child home, they should make their child comfortable. Check that the toes don't swell or change colour, that the cast stays dry and clean and doesn't slip down the child's leg. A new cast should be applied every week for about 4 to 6 weeks, as each one will slowly move the foot towards the fully corrected position. JD's little boy, Joel, is currently going through the casting process.
It's not the nicest experience because the baby is a bit uncomfortable with the cast and it's not easy to bathe him normally.
At first we were worried. I discovered that things gonna be well. So far so good. Yeah, so I'm happy.
In clubfoot clinics, clinicians and parent advisors see children at different stages of the casting process, having their 2nd, 3rd, 4th, 5th and even 6th casts fitted.
It's going well. My child had tenotomy.
She's in a casting stage.
Tenotomy is the next step in the correction phase. It is a safe and simple procedure.
Tenotomy is a small surgical procedure to release the tight heel cord. We have to inject just a local anesthesia. So it allows the foot to rise above the ankle to help the child walk well and normally.
La tenotomía.
Tenotomy is a very important step that we perform on almost all children.
After tenotomy, a final cast is applied for 3 weeks. Maintenance is the 2nd and last stage of the Ponseti method, which requires the child to wear a special shoe brace to maintain the foot's position and prevent the clubfoot from coming back. This is called a foot abduction brace and has 2 shoes and a bar to keep the feet fixed in position. Children have to wear the brace for 23 hours a day for 3 months, then only at night and daytime naps for at least 12 hours every day until they are 5 years old. During the bracing period, it is very important that parents follow the clinician's instructions, as they will have to fit the brace every day themselves and make sure it is worn for the correct period, even if the child cries. If this is not followed, the clubfoot could return. After the first fitting, the family should come back to the clinic to check the brace in 1 to 2 weeks, and then for another review in 4 to 6 weeks. These review appointments then take place every 3 months until the child is 2, and then every 6 months until the child is 5 years old.
Today I'm having the 3rd cast.
My child is 9 months old and started wearing braces for 3 months, day and night.
Coming here and meeting other mothers, and then you also interact with them, you ask them what You've been here for how long? They tell you for 2 years, for 1 year, and you see the kids they are walking around. So with that, you get encouraged, knowing that also your kid is also going to walk normally like any other kid.
When I first arrived at the clinic, they welcomed me. They started with the casting stage. At the next session, I started to have hope. Things now look really great, and I am so hopeful for my child.
Children with clubfoot don't need to face a lifetime of disability. If they are treated with the Ponseti method early and follow all the clinician's instructions step by step, they can lead a full, active and pain-free life.